हाय एवरीबॉडी। आई होप आप सब अच्छे होंगे। सो मैं आपके लिए आज लेके आई हूँ इम्प्लीमेंटेशन पार्ट ऑफ फॉस्की। मेरा नाम है जसलीन कौर एंड मैं आरएन हूँ यूके में। और मैं आज आपको इम्प्लीमेंटेशन के बारे में बताऊंगी। तो ऐसा हमें फर्स्ट पेज दिखेगा इम्प्लीमेंटेशन का। तो हमने अपना नाम लिखना है सबसे पहले, ठीक है। देन वी हैव टू रीड द सिनेरियो. When we read the scenario, then we got the idea about what it is, okay, whether it belongs to neurological part, respiratory part, or whether to the abdominal part, okay. Then, or homelessness. The scenario is about Joe Smith being treated for subdural hematoma. Please administer and document medication safely in accordance with NMC standards. Then we have to make an introduction. We have to introduce ourselves, why we are coming here. Good morning, good afternoon. Myself is Jasleen Kaur. I'm one of the registered nurses working here in this ward. I am going to give you the tablets. Is it the right time to give you the tablets? May I proceed? So we have to take the consent and we have to tell the patient what we are going to do. Okay, then the patient will give the consent, then we have to proceed. We have to read each and every part of the implementation paper, and we have to rule out which is the right medication which is due at our time. Then we have to read out the chart and explain what we are giving, what we are checking, and what we are not giving and why. Okay, we have to explain the examiner. We have to do all the checks, and that is checking the right patient, right drug, right route, right prescriber. Okay, we have to complete the documentation and we have to use the correct codes why we are not administering that medication. The codes for non-administration on the chart are on the chart. The codes are given on the chart itself. Okay, then we have to read that this is the 15-minute station. Okay, including all the documentation. We will not be provided with extra time for the documentation. We have to complete all the sections of the document. ठीक है, assume it is today, the date is of today and time is 2:14 hours. So we have to give the medication of which is due at 2 p.m. Okay, then we have to read this: surname Smith, forename Joe, date of birth 07/11/1968. We have to check that with the patient ID band. Joe Smith, date of birth 07/11/1968, hospital number 001-234 ward is MAU medical administration admission unit, and date of admission is today. Height of the patient is 1.80, weight is 105 kg, body surface area in meter square, which is not given but it will be given in the examination. Consultant name is Dr. Khan. Time of admission is 8 a.m. Then name of the prescriber B Khan, GMC NMC number 34540, signature is present, bleep number is present. Then the detail of the person who is administering, we have to put our name here. Okay, we have to put, I am going to put my name, initial and signature, and base is MAU. Okay, and the allergies, the patient is as per the documentation, the patient is not having any allergy. I am confirming that with the patient. Hello Mr. Joe Smith, how can I call you? Okay, Joe. Joe, can I check your ID band? Is, do you have any allergy? No, I don't have any allergy. Okay, I confirm with the ID band also. So the patient have no uh, allergy. It is mentioned on the paper. I confirm with the patient and I double check with the ID band also. Then uh, after that we have to say that it is the patient is not having any allergy. It is checked by Ms. B Khan and bleep number is present and date is present. So the patient is not having any medication risk factors. Then next page, moving to the next page, the patient name is surname is Smith, forename is Joe, date of birth is 7/11/1968, and the rest of the details are same as that of the previous page. Okay, so we are now these are the codes which we have to use. If the patient if the medication is unavailable, we have to use the code 1. And if the patient is off ward, code 2. Self administration, code 3. Unable to administer, inform doctor, that is 4. And start dose given, that is 5. 6 is for prescription incorrect. 7 is for patient refused. 8 for nail by mouth. 9 for low pulse or low blood pressure. 10 is for other. State in nursing notes including action taken. Okay. Then once only medication, pre-medication, antibiotic prophylaxis, and patient group direction. Once only medication, the date is today, drug is paracetamol, dose is 1 gram, route is IV. Instructions for pain, time required 9 a.m. Prescriber signature, print name, bleep number is present. Time given is 11. So it is given already given at 11 a.m. So the signature of the administrator is present and pharmacy check is done. So the prescription is clear, legible, and complete. The next dose is for once only medication is vitamin K. Date is today. Dose is 10 milligram. Route is intravenous, and instruction for coagulation. Time is 1 p.m. 13 hours, and prescriber signature, print name, bleep number is present. So time given, at which time it is given is 1 p.m. 5 minutes. Then signature of the administrator is present. So the once only medication are not due at my time. Okay. So we have to say that. Okay, we have to read. It's not the point like if the drug is not due at our time, so we are not going to read. We have to read each and everything which is present. Okay, then moving to the next part, then moving to the next page, the patient name is surname Smith and forename is Joe, and date of birth is 07/11/1968. So the rest of the details are same as that of the previous page. And prescribed oxygen, so the patient is uh, the target oxygen saturation for the patient is between 94 to 95 98 percentage, and the device we are using is nasal cannula, and the flow rate is 2 liter per minute, and start date is today, and the time is 8 to 10 a.m. So it is already given. This signature of the administrator is present. Stop date is also today, and prescriber signature, print name, bleep number is present. So it is the correct prescription. It is already given, so it is not due at my time. Moving to the next page, the patient's name is surname Smith, forename Joe. Date of birth is 07/11/1968. The rest of the details are same as that of the previous one. So the next medication we have to administer is antimicrobials. So the drug is so the patient is not prescribed with any medication, antimicrobial medication. Then moving to the next page, the patient's name, surname is Smith, forename is Joe, date of birth is 07/11/1968. The rest of the details are same as that of the previous page. So moving to the regular medications, the first drug which is prescribed is cocodamol, and the date is today. Dose is 16 by 1000 milligram. Frequency is 3 times a day. Route is oral. Duration is 7 days. Time is at 6 a.m. It is already given. And for 12 p.m. So it is due at my time. So I will give that medication. It is for pain. The prescriber name, bleep number is present. So the prescription is legible, clear. Okay. And then if you are not clear the previous dose is given or not, then you have to ask the patient whether you have given with the previous dose, or you can say that I will confirm that with the previous staff. If it is not given, then I will give that, or if it is also given, then I also give my due medication, okay, which is due at my time. Then you have to check the patient's name. So can I check your ID band? So the patient name is Joe Smith. Joe Smith, date of birth 07/11/1968, and the hospital number is 001234. And so the patient is not having any allergy, and I am checking that with the my documents also. The patient is having same name, same date of birth, and the patient is not having any allergy. So we have to check, okay, before giving the medication. Then so I am giving you the Cocomadol tablet. It is for your pain, okay, and the side effect of this tablet is like dizziness, constipation, restlessness, but you don't have to worry. We are here, we will take care of you, and if you feel any kind of side effects, just uh, press the buzzer and we will help you definitely, okay. We have to say that. Then we have to give that take that medication, okay. And then next drug is digoxin. The date is today. Dose is 105 microgram, 1 to 5 microgram. Frequency is once a day. Route is oral. Duration is continuing. Time is 14 hours. So it is due at my time. It is for atrial fibrillation, for regulating heart rate. The name of the prescriber and bleep number is present. So the prescription is clear, legible, and valid. So I'm happy to give the tablet. So I'm also giving you digoxin tablet, okay. We have to tell the patient, can you please tell me your name, date of birth? Okay, it is Joe Smith. We have to check with that ID band and with our documentation, so the patient is correct. And we the side effects of this medication we have to tell the patient, okay. We can also use BNF if we are not sure. We have to tell the patient the side effects. You can feel diarrhea, changes in your vision, skin rashes, feeling sick, okay. These are the common side effects, but you have not to worry. We are here to help you. If you feel any side effects, please press the buzzer. We will definitely help you, okay. The next medication, moving to the next page. The patient's name is, surname is Smith, forename is Joe, date of birth is 07/11/1968, and as required medication, first drug is paracetamol. The date is today. Dose is 1000 milligram, and frequency is as needed. Route is oral. Duration is continuing. Time is not prescribed. So we have to ask the patient, do you have any pain? Okay. Then we have to give that medication. Okay. We have to set that it is for your pain. Okay. And we have to check in between 10 to 1 to 10 where you rate your pain. Okay. Then you have to give that medication. We have to put the time here, okay. 14, and we have to sign here, okay. Then no other as required medication is prescribed. Then moving to the next page, the patient name is Joe Smith, date of birth is 7/11/1968, and rest of the details are same as of the previous page. So infusions, the patient has no prescribed with any infusions, and omitted dose. We haven't omit any dose. If we, for example, omit any dose like today's date, what is today? So we put today's date. For example, today is 6th of June. We have to put the date. Drug, for example, PCM. Dose is 1000 microgram. Route is oral. Instruction is as required medication. Time given is 14 hours. Reason for omitted: once only pain medication given. Okay, that is our insight whether we have to give that medication or not. Okay, then signature J Kaur. Okay, so that is how we fill that. Okay, then everything we have filled, that is completion of our paper. documentation. Now checklist, what we have to do, I will tell you in short. We have to do hand hygiene, introduction of yourself, consent prior to the administration of medication, allergy we have to check with the ID band with our form and with the person. Before administration any prescribed medication we have to check, okay, like oxygen, and we have to check the prescription whether the signature of the prescriber is present, okay. We have to do the documentation. Drug dose we have to check, date and time of administration, route and method of administration, diluent if any have to use, correctly check all of the following. Validity of the prescription we have to check when it is prescribed, signature of the prescriber, whether it is legible, and any piece of information is missing then we have to tell the nurse, okay, not, we have to tell the prescriber, we will not proceed with the administration. Okay, we have to explain indications, contraindications of the drugs. We have to highlight the specific information regarding when we have to take the medication, whether empty stomach or with food or after food. Okay. Then due administration, we have to administer correctly and safely. Omit, whether we omit the drug, we have to administer. We are not giving. We have to provide a verbal rationale also, and we have to document that also. Okay. Thank you. Like and subscribe my channel. Thank you for watching. Please support me, okay, subscribe my channel and share with your friends. It will give me motivation to make more videos to help you. Thank you. Bye.